Hello and welcome back, or if you're new here, welcome to the channel where we talk predominantly about topics related to mental health and where I strive to inform you all about various topics related to mental health. So in this video, I will be doing a general overview of bipolar disorder. Bipolar disorder, which was formerly called manic depression, is a mental health condition that causes extreme mood swings, the emotional highs, mania, or hypomania, and lows, depression. When you become depressed, you may feel sad or hopeless and lose interest or pleasure in most activities. When your mood shifts to mania or hypomania, less extreme than mania, you may feel euphoric, full of energy, or unusually irritable. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Episodes of mood swings may occur rarely or multiple times a year. While most people will experience some emotional symptoms between episodes, some may not experience any. Although bipolar disorder is a lifelong condition, you can manage your mood swings and other symptoms by following a treatment plan. In most cases, bipolar disorder is treated with medications and psychological counseling, also known as psychotherapy. There are several types of bipolar and related disorders. They may include mania or hypomania and depression. Symptoms can cause unpredictable changes in mood and behavior, resulting in significant distress and difficulty in life. Symptoms of bipolar disorder are as follows. Bipolar 1 disorder. If you've had at least one manic episode that may be preceded or followed by hypomanic or major depressive episodes. In some cases, mania may trigger a break from reality, also called psychosis. Bipolar 2 disorder. If you've had at least one major depressive episode and at least one hypomanic episode, but you've never had a manic episode. Cyclothymic disorder. If you've had at least 2 years or 1 year in children and teenagers of many periods of hypomania symptoms and periods of depressive symptoms, though less severe than major depression. Other types. These include, for example, bipolar and related disorders induced by certain drugs or alcohol or due to a medical condition such as Cushing's disease, multiple sclerosis, or stroke. Bipolar 2 disorder is not a milder form of bipolar 1 disorder, but a separate diagnosis in itself. While the manic episodes of bipolar 1 disorder can be severe and dangerous, individuals with bipolar disorder can be depressed for longer periods, which can cause significant impairment. Although bipolar disorder can occur at any age, typically it's diagnosed in the teenage years or early 20s. Symptoms can vary from person to person, and the symptoms may vary over time. Mania and hypomania. These are two distinct types of episodes, but they have the same symptoms. Mania is more severe than hypomania and causes more noticeable problems at work, school, and social activities, as well as relationship difficulties. Mania may also trigger a break from reality, also called psychosis, and may require hospitalization. Both a manic and a hypomanic episode include 3 or more of these symptoms: abnormally upbeat, jumpy, or wired, increased activity, energy, or agitation, exaggerated sense of well-being and self-confidence, also referred to as euphoria, decreased need for sleep, unusual talkativeness, racing thoughts, distractibility, poor decision making, for example, going on buying sprees, taking sexual risks, or making foolish investments. Major depressive episodes. A major depressive episode includes symptoms that are severe enough to cause noticeable difficulty in day-to-day activities, such as work, school, social activities, or relationships. An episode includes 5 or more of these symptoms. Depressed mood, such as feeling sad, empty, hopeless, or tearful. In children and teens, depressed mood can occur as irritability, marked loss of interest or feeling no pleasure in all or almost all activities, significant weight loss when not dieting, weight gain, or decrease or increase in appetite. In children, failure to gain weight as expected can be a sign of depression. Either insomnia or sleeping too much, either restlessness or slow behavior, fatigue or loss of energy, feelings of worthlessness or excessive or inappropriate guilt, decreased ability to think or concentrate, or indecisiveness, thinking about, planning, or attempting suicide. Other features of bipolar disorder are as follows. Signs and symptoms of bipolar 1 and bipolar 2 disorders may include other features such as anxious distress, melancholy, psychosis, or others. The timing of symptoms may include diagnostic labels such as mixed or rapid cycling. In addition, bipolar symptoms may occur during pregnancy or change with the seasons. Symptoms in children and teens. Symptoms of bipolar disorder can be difficult to identify in children and teens. It's often hard to determine whether these are normal ups and downs, the results of stress or trauma, or signs of a mental health problem other than bipolar disorder. Children and teens may have distinct major depressive, manic, or hypomanic episodes, but the pattern can vary from that of adults with bipolar disorder, and moods can rapidly shift during episodes. The most prominent signs of bipolar in children and teens may include several mood swings that are different from their usual mood swings. When you should see a doctor. Despite the mood extremes, people with bipolar disorder often don't recognize how much their emotional instability disrupts their lives and the lives of their loved ones, and they usually don't get the treatment they need. And if you're like some people with bipolar disorder, you may enjoy the feelings of euphoria and the cycles of being more productive. However, this euphoria is always followed by an emotional crash that can leave you depressed, worn out, and perhaps in financial, legal, or relationship trouble. If you have any symptoms of depression or mania, see your doctor or mental health professional. Bipolar disorder doesn't get better on its own. Getting treatment from a mental health professional with experience in bipolar disorder can help you get your symptoms under control. When you should seek emergency help. Suicidal thoughts and behavior are common among people with bipolar disorder. If you have thoughts of hurting yourself, call 911 or your local emergency number immediately. Go to an emergency room or confide in a trusted relative or friend. Or you should contact a suicide hotline. In the U.S., call or text 988 to reach the 988 Suicide and Crisis Lifeline. They are available 24 hours a day and 7 days a week. Or use Lifeline chat services. The services are free and confidential. If you have a loved one who is in danger of suicide or has made a suicide attempt, make sure someone stays with that person. Call 911 Call your local emergency number immediately. If you think you can do so safely, take the person to the nearest hospital emergency room. Causes. The exact cause of bipolar disorder is unknown, but several factors may be involved, such as biological differences. People with bipolar disorder appear to have physical changes in their brains. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Genetics. Bipolar disorder is more common in people who have a first-degree relative, such as a sibling or parent, with the condition. Researchers are trying to find genes that may be involved in causing bipolar disorder. Risk factors. Factors that may increase the risk of developing bipolar disorder or act as a trigger for the first episode include having a first-degree relative such as a sibling or parent with the disorder, periods of high stress such as the death of a loved one or another traumatic event, drug or alcohol abuse. Complications. Left untreated, bipolar disorder can result in serious problems that affect every area of your life, such as problems related to drug and alcohol use, suicide or suicide attempts, legal or financial problems, damaged relationships, poor work or school performance, co-occurring conditions. If you have bipolar disorder, you may also have another health condition that needs to be treated along with bipolar disorder. Some conditions can worsen bipolar disorder symptoms or make treatment less successful. Examples include anxiety disorders, eating disorders, attention deficit hyperactivity disorder, or ADHD, alcohol or drug problems, physical health problems such as heart disease, thyroid problems, headaches, or obesity. Prevention. There's no sure way to prevent bipolar disorder. However, getting treatment at the earliest sign of a mental health disorder can help prevent bipolar disorder or other mental health conditions from getting worse. If you've been diagnosed with bipolar disorder, some strategies can help prevent minor symptoms from becoming full-blown episodes of mania or depression. Pay attention to warning signs. Addressing symptoms early on can prevent episodes from getting worse. You may have identified a pattern to your bipolar episodes and what triggers them. Call your doctor if you feel you're falling into an episode of depression or mania. Involve family members or friends in watching for warning signs. Avoid drugs and alcohol. Using alcohol or recreational drugs can worsen your symptoms and make them more likely to come back. Take your medications exactly as directed. You may be tempted to stop treatment, but don't. Stopping your meds or reducing your dose on your own may cause withdrawal effects, or your symptoms may worsen or return. I hope that this has helped someone with some questions that may have related to bipolar disorder. I will be doing a follow-up to this where I will be digging deeper into bipolar disorder and the things related to it. If you have any questions for me, feel free to leave them in the comments section. Or if you like what I do here, like this video, comment, and subscribe to my channel. Because I started this channel to help people with their battles of their mental health struggles, because the more subscribers I get, the bigger a community we can have to discuss mental health struggles and our victories over our mental health conditions. This has been Chris, Mental Health Advocate, and until the next one, I'll catch you on the flip side.